Hello everyone, welcome back to the channel. This is Dr. J. I have one patient for you today, and it's a ginormous, enormous, massive earplug. And I produced one not too long ago, and I titled that one, I struggled with this one. And I find it very similar in quality to that video, if you remember that one. I worked really hard for a long time, and eventually it came out, and it wound up being the full length of the ear canal, just all the way to the eardrum, and it came out in one big piece. So this one, I would say as well, I struggled with this one. It just was so deep and had this wrap of keratinaceous debris and skin around it that just wouldn't let go. So in this video, kind of showing the instruments that I use. There was a picture of the Fraser suctions that I utilize, 3 different sizes, 3, 5, and 7s. I use bigger ones all the way up to a 12 and a 14 that we use for sinus debridements, so inside the nose. And that's the size of your typical Fraser suctions, anywhere from 1 millimeter to 2 millimeters in diameter. And as I entered the ear, and it was right at the entrance, you can see you're at the entrance here because you see the hair of the ear canal. I immediately start with collace. I figure out real quick that this is going to be a stubborn plug, so I don't hesitate. Once I get up some edges around the plug, I go ahead and instill the collace to get some lubrication to help us out here. And this is something you've seen before, where you just try and work up the edges to the point where you can work the lubricant, whether that's olive oil or collace or mineral oil. You just want to get that lubrication in there to separate the wax plug from the skin of the ear canal. It wasn't moving with suction, so I go in with my right angle, and you can see the size and the shape of it there on the top right side, and also the alligators right next to that too. And it digs in just fine, but it's soft enough on the entrance here, or at the entrance, that it just pulls through, and so I don't get a good grip on it. And sometimes these move, and I'm like, oh, there we go. We're getting some movement, but then that's it. That's all it gives me. As we watch this here for a moment, I just want to say to all of you who watch my videos and subscribe and make comments, I asked on the last video for you guys to leave a comment, let me know what you think, hopefully improve the YouTube algorithm, because they've significantly decreased my visual on YouTube, and you guys came out, and I think we're at over 100 comments so far, and I appreciate all the positive comments. I really just want to thank you from the bottom of my heart. I appreciate you not only liking, subscribing, commenting, but keeping those comments positive. It gives me motivation to keep on going, even though I'm not making money doing this stuff. It is a hobby of mine, but it's certainly not worth my time, other than just the satisfaction of having been on YouTube for 15 years. And so now I'm switching to the next instrument, which is an alligator forceps, and hopefully just trying to get a purchase of it enough that I can slide it out, but still, it's just breaking off towards the front. I've probably removed at least a good half a centimeter to a centimeter of wax already. You can see that we're deeper into the ear canal, just past the hair-bearing portion of the ear canal. And it's still not budging. And I try it from every angle, trying to get a purchase, but it just keeps falling apart. And I keep thinking to myself, well, what other instruments do I have that could assist with this? And there you see a little window of opportunity there, getting the collace nice and deep down in there. I don't often like to dig out a cerumen plug. In other words, where you just apply a lot of pressure and you're just scooping out pieces of the plug. But we get to the point here where, it seems like it's really shaky, but what I'm doing is I'm just pointing the speculum into the different areas where I can work around them. it gets to the point where I'm going to have to start just scooping this out piece by piece because it's just not coming out on its own. Despite my best efforts, every time I get a good purchase, it just falls apart under the instrument that I'm using. The curette that I was talking about before, there's several different types. Curetting, or the bigger word would be curettage, is something that applies a lot of pressure in the ear when you start doing it, and so it can be uncomfortable for patients, and I just don't like to use it a lot. I use it pretty frequently on ear cases in the OR because the patient's under anesthesia and they're not responding to that pressure and potentially pain from the curette. There I used a bigger alligator forceps, and it was too big to fit into the ear canal there. So here is a wire loop curette, and you can see by the name wire loop curette, and there's other types of curettes. You can have a solid loop curette, and you could have slightly ridged, a little bit abrasive tips to the curette. But we just starting to dig out the front pieces. But while I'm doing this, I'm also still manipulating the plug. Hopefully we can get it to disconnect from the ear canal wall and have it come out. There we go, switch back to suction. I started to see some decent movement and a lot of clear space in there between the plug and the ear canal wall, so I thought I'd be able to, once I saw that, to be able to then just grab it with suction and pull it out. This is the number 7 suction again. It's the larger of the ones we usually use in the ear, and it's still being just a little bit stubborn. We'll get a few more pieces out here with the alligator forceps. You can see there's a lot of hair in here as well. The patient had originally presented with hearing loss and ear pressure. And so I have to imagine that, and if I remember correctly, he had been using earbuds a lot for music and videos. And so there you see you're starting to get some really good movement there. We'll get the plug out towards the entrance, and we're about to deliver this thing to the open air here. And it was very obvious. It was the full length of the ear canal from the outside all the way to the eardrum. You can see how it's kind of bent there. It went all the way into the anterior sulcus. And I'm so glad it came out in one piece. Otherwise, this would have been absolutely a nightmare to keep trying to curette out. Looking back in the ear, just a little cleanup. There's a little bubble of colace left deep into the anterior sulcus right on the tympanic membrane. And once we get that cleared up, we got a normal looking tympanic membrane, and that's it. Enormous wax plug. Thanks for watching. Thanks for subscribing. I appreciate your support, and we'll see you on the next video. Have a great day.